So when we come back, we'll be meeting Dr. Greg Haraski and seeing a couple of the patients that he's operated on or is treating right here in his office.
I love orthopedic doctors, and I had no idea that there were actually a subspecialty like that.
A subspecialty.
Wow. Well,
Excellent
good story.
job.
We're going to head out right now, actually, to Desert Samaritan Hospital. That's where Dr. John Shufeldt is with a pediatric orthopedist. Hi, Dr. John.
Hey, Marty. Hey, Scott. How are you?
Terrific.
We are out here with Dr. Greg Haraski at Cactus Orthopedics out at the campus of Desert Samaritan Hospital. Dr. Haraski, welcome.
Thank you.
Good to have you on. Hey, if you can, show us that surgery you're doing. What were you actually doing on here? Like, for example, this X-ray. That's the before shot, correct?
That youngster had a instability of the growth plate here, where basically the head or top of the femur was slipping off of the neck, and we stabilized it with this high-tech screw device. Basically, the screw threads are to stabilize this growth plate orifices from slipping further.
And it just wouldn't slip off. How common is that injury?
Well, it's pretty common in boys with his body habitus. He was a larger young man, and it's thought to be some overlay of adolescence as hormones fight each other for predominance in the human body, combined with a high activity level.
Not real common, right?
Not terribly common, but not terribly uncommon either.
All right. Now, moving over here to Katie. Katie, you are, let's see, 13, a 7th grader at Mountainside Middle School. What happened to you?
I fell skiing and it hurt my humerus.
You hurt your humerus?
Yep.
And there's nothing funny about that, correct?
Right.
All right. Now, which X-ray is yours? Do you know?
That one right
One over here. So you see that little crack right there? Right about there. Now, what's Dr. Haraski doing for you?
He's giving me a hanging cast.
And so the bones...
Well, I don't really know exactly.
We'll get back together, right?
Yep.
All right. So, Dr. Haraski, tell us a little bit about how Katie's being treated.
Katie's being treated. We're helping nature do its own course here. We're helping this fracture heal itself, and her hanging cast is going to provide traction to help keep the fracture fragments in alignment and also relax her muscles so she'll be more comfortable. It seems peculiar that the cast is on the lower segment of the arm, but again, it's to provide traction.
All right, it just pulls the bones apart so they heal back up.
Exactly.
All right, moving over here to Amelia and Mary. Hello, Amelia. And look how well you match this pink. So what's going on? And this is Mary. Mary, what happened to your daughter?
Well, she's wearing the cast. She fell out of her crib, so she has a separation of her growth plate, and she has a chip in her wrist bone.
And then how about her feet also? You mentioned that she has some orthotic shoes on. Tell me about those.
Yeah, well, these are to keep her feet straight. When we first started coming to Dr. Haraski, she was about 2 months old, and she went through a series of casts until she was about 6 months old. And when we first came in, her feet looked like kidney beans,
wow,
basically, and her big toe was almost touching her little lower leg here, and so she really did look like that, and he straightened her
out. And now
out.
she's walking straight. Dr. Haraski, tell us a little bit about that. We have about 30 seconds left.
Well, Amelia had a developmental or partially congenital foot condition in which her feet were dramatically inturned and quite rigid, and they just would not come along with simply stimulating or molding the muscles in and of themselves. So we did a set of serial casting,
and now she's
come along quite a
walking back straight, it sounds like.
No, not quite walking yet, but we're getting to that point.
There you go.
I think in a month she'll be on her own.
Very good. Well, Marty and Scott, we're out here at Cactus Orthopedics with Dr. Greg Haraski. You can find out more about him at www.aztopdoc.com.
That's terrific.
I'll tell you what, that baby, she's doing the thing with her feet, and then she managed to get out of her crib on top of that and break her arm. She's going to be a top-level athlete, I can just tell.
She pole vaulted right out of the crib and broke her arm, so she is all over it.
And it's not even phasing her the least.
No,
Like,
not at all.
cutie.
She's a natural.
I love her, and I think that cast is cute. But
Plus, apparently she drives her own car already. She has her car keys and everything. Thank you, Dr. Shufeldt. All right. What?
You're just funny. You're funny. I love this humor I get to enjoy every day. aztopdoc.com for any more information on any of the physicians.